Hi, everybody. Welcome to another episode of ASAP Pathway. I am your host today, Dr. Stacy Ochoa, and I'm super, super stoked to have one of our ASAP Pathway providers on today. I had to have her on today. She's just a rock star. We've been literally talking probably for an hour before we started this. Dr. Julie Davis, welcome.
Thank you.
You are a rock star of sorts, really. And I mean, your TikTok channel, your Instagram, you have tons of followers. I'd love to do an introduction so people know a little bit about you. And then we'll dive into the conversation and just why it's so important to get the conversation, kind of what we were having beforehand out there. So our medical colleagues can hear, other dentists can hear, parents can hear, because it's super important. Um, I love our mom practitioners because I think it's just interesting how we all have a similar journey and it's a similar why with all of us. But let me do a little background for those of you that don't know Dr. Davis. She grew up in Park Ridge, Illinois, received her Bachelor of Science degree in molecular and cellular biology from the University of Illinois at Urbana-Champaign. She then completed her Doctor of Dental Surgery degree at the University of Illinois at Chicago in 2014. She had special honors training in implant dentistry, endodontics, and pediatrics. She's a member of the National Dental Honor Society, Omicron Kappa Epsilon, OKU. She received special recognition for exceptional commitment in the care of patients and for interest in teaching dentistry. She's a member of the ADA, the ISDS, CDS, and the AGD. And like I said earlier, your social media following is so impressive. She has like 11,000 followers on Instagram, 180,000 followers on TikTok. She uses social media to provide education to viewers in bite-sized amounts. And a lot of her posts are about airway or pediatric development because that is what she's going through as a mom of three. So thank you so very much. I want to get to our conversation and so you have three kids. What are their ages?
4, 2, and 2 months. So
You're tired.
yeah, last night was interesting. My husband's out of town, so
Oh gosh, girl. And you're a busy mom, you're a busy dentist.
huh.
And just something we were talking about before we went live with this was not only are you a busy dentist, but you have such a passion for pediatric airway, sleep, growth and development, early interceptive when it's super impactful. So tell us about your journey. Like what got you started in all this? Because it's a whole other layer to be a general or primary care dentist, I like to say. You've got restorative, we've got oral health. We're dealing with that. But then you have all this. I mean, we aren't taught this in dental school, Julie. It's a lot of learning, a lot of education we have to go through to provide this other service.
When I started learning about just all of the things that surround pediatric jaw development and why it's important, I felt like I was drinking from a hose. I mean, you just like there's so much to learn that you realize you kind of have to have a passion for it, or you won't make the time to really understand it. But it's exciting. It's like I want to find the time to learn about it. My 4-year-old, when she was born, I really wanted to breastfeed. And I exclusively breastfed for 6 weeks. And, like you were saying, it's kind of crazy when you're a business owner and a dentist. And I only planned to take 6 weeks off. So she had to start a bottle. And after that, she really didn't want to breastfeed. And so I got a lactation consultant who said, "Oh, I think she has a tongue tie." And I said, "What? I'm a dentist. How did I not know that?" And so then my lactation consultant referred me to a pediatric dentist who does tongue tie release, who said, "Well, she's 3 months now. I could release the tongue, but I don't know if it's going to help you breastfeed. I don't know if you should do it. Now I know I should have." But she sent me to a feeding specialist who didn't specialize in infants, who said, "Oh, your daughter has reflux." Now I know reflux is a symptom of tongue tie. And so I didn't do anything. We bottle fed, and I decided I needed to know more about tongue tie. Tongue tie led me to the place I'm at now, which is, doing expansion for kids under 6, or, helping families figure out what the problem is, at that really important age when they're growing like at the speed of light.
Yes, that's a really good description. It's a unique growth opportunity that up until 5 and 6 years old. Yeah.
I mean, if people do miss and they make that decision, that's okay. There will be other catches later on, but you never get that, anyway. So she is in treatment now. She's 4, and we're doing Invisalign, and it's amazing how well it works on this age group, in my opinion. But she's really the reason I started, with tongue tie. I did a Breathe Institute course, then I went to Richard Baxter's course, and then I met Dr. Gaveless, who is a tongue tie guru in our area, and he's like, I really like, I can do the tongue ties. I really like, we need somebody like Dr. Boyd who is going to make room for the tongue, do expansion. And
Yes.
I actually met Dr. Gaveless through Dr. Boyd, but Dr. Gaveless really encouraged me to focus on the growth rather than the release of the tongue. And then I started taking all these courses and found you guys. But it's been a great journey. Both of my other 2 kids had releases before they were 2 weeks old. And we did myofunctional therapy and craniosacral therapy. And you start learning about all these cool things that you can do for the body at that age.
It is so impactful to get to these kids when they're that young. And there is, as you and I were discussing, there are some naysayers that don't agree with early interception. They don't think it makes a difference, or they think it's, definitely not necessary, or why would you have someone, a parent have to go through expansion multiple times? They're just going to need it again later. Just wait till later. But as you know, in the journey with ASAP Pathway, we're always looking at literature and talking about what we're finding in our practices around the world and how it's impactful and the differences we're seeing in children. And the literature is emerging. The literature is there.
And just the slogan of our ASAP pathway being kids can't wait. I mean, I don't understand the people who don't want to treat these kids, like I said, to learn all of this, it takes time. And
It
I mean,
does.
so much out there and it's not taught in the dental schools. And it's okay if somebody doesn't want to learn it, but don't poo-poo the people who do. I mean, there's different ways to do everything in life. And, some people are looking for us because they can't get answers from their pediatrician who's practicing, you know, by the book, anyway, it takes a long
what they were taught in med school, because this isn't taught in med school either.
right. They get 1 hour of sleep, I think, in med school. And I
Yeah.
mean, dental, I don't know that we even got any,
I mean, I think I got an hour. Everything
yeah.
I learned was after dental school. So, I mean, and that's okay. I mean, I get it. We're working on, I know that Audrey Yoon is working on having their orthodontic residents will also be trained in sleep when they graduate. So it's pretty amazing. Yeah, it's amazing. And that's at believe at Stanford, where she's an adjunct professor. I mean, it's phenomenal what she's doing. Rebecca Brokaw, all of them, they're doing amazing things. But I mean, I think your story is a lot of people's story, and a lot of our ASAP Pathway members, they get involved because it's either I want to help my kids, or I want to help my sister's kids, or my niece and nephew, or I've got kids in my practice, I don't know what to do, and nobody is helping. So
Yeah.
I think it's interesting.
Yeah, it's been an interesting journey for me because my 4-year-old, she was, colicky. And really, when I look back, there's so much I could have done, and you can't, you only know what you know. So I have to be careful not to be mad at myself.
That's exactly right.
But my baby is so comfortable in his body already from the work that we've done. Like even compared to like I did a lot for my second that I didn't for my first. You just learn. It's really incredible what we can do when we know what to look for.
That is so true. And that's where I think sometimes too, we're comparing apples and oranges in this realm of orthopedics or orthodontics in this age group in the demographic of, 2, 3, 4, 5, 6, because it's what are you looking at? What glasses, what lenses, what are you looking through? What's someone else looking through? We might have two different diagnoses and two different treatment plans. And that's okay because we're looking through different lenses, right?
Right.
It doesn't make it wrong. It's just where is that practitioner coming from? What is their education base? What is their knowledge base? What is their philosophy? What
Mhm.
is your philosophy as a patient? What are you looking for? If all you're wanting is straight teeth, that can be done at many ages, many different ways. But if you're looking for optimal growth and development interception, if you're looking for, appropriate breathing, appropriate function, appropriate neurocognitive growth and development, okay, we might have different treatment plans.
For answers to why you're having behavior issues with your child, or you're looking for answers for why your child won't eat anything, or why they have asthma and allergies and skin issues. And um, it's um, it's different and it's important, but like we were talking about, I think it's different. So when you don't know about it, it's easy to not support it, like the article we were talking about before we came on. He just doesn't know.
And
And
and and that's and it's funny because and for those of you that don't know what we were talking about, there was an article in the AJODO and it was an orthodontist saying that, just if you want to discuss basically if you want to be screening everybody for airway and breathing issues, maybe you should have gone to med school instead of gone into dentistry, basically, is what they were saying, which is so completely insulting because we're oral physicians, we're trained in head and neck anatomy.
and there's research showing that if we guide the growth of the jaws, the airway is going to change. So how can you say that
They're
we don't
not connected.
deal with it? I mean, it's like it's the entryway to the airway, really.
Well, you have an airway behind the dental arches
Right.
and you have an airway above the dental arches. So the dental arches matter and they influence, it's like the chicken or the egg, airway influences growth and development and growth and development influences airway. So you can't do one without the other. You really need to have an understanding, and working with the ENTs and allergists and myofunctional therapists is so important. And my when I was reading that article, I was like, wow, he's so angry, which was interesting to me. Just so much anger, and just you could hear the tone of just within like the first few sentences of his opinion article. And I was like, wow, why is he so angry? And I think what it boils down to, and I keep saying this, is I think some people are very fearful. They're fearful of change, and they look around and they see other people doing things that they don't necessarily want to do in their practice. But if you don't want to do it, like we said earlier, okay, you don't have to do it. I mean, it is your obligation to screen and screen every single human that walks through your practice. As a very highly educated healthcare provider, you should be asking them how they're breathing and sleeping and looking at their face, and not just looking at the white things. But um, I'd love to talk about. Oh, go ahead. What were you going to say, Julie?
I was just going to say that, like you were saying, the arches really matter. I mean, if you really think about, the tongue sits in between all of our teeth, and it's what develops our nose, really, the base of our nose. So if the tongue is where it's supposed to be in the roof of the mouth, you grow a wider nose. And why would, I don't know, it makes sense to me that we should be looking at this.
It's funny. It makes sense to parents too. It's not really rocket science. I
Right.
mean, it's really not rocket science. And when I show a parent a cone beam and I explain that the tongue is a natural expander, okay, it's developing. And we've got plenty of articles and literature that describe the function of the tongue and the muscle and the pressure of the cheeks and the pressure, the internal pressure of the tongue going out and that force up and natural expansion of the upper arch and where the teeth lie, they're at the mercy of all these muscles. The bone is at the mercy of the muscles. It goes, form follows function.
Muscle always wins.
Muscle always wins. So if you have a child not breathing well, and then you've got a side effect of the tongue with low tone hanging in the floor of the mouth, and you have poor swallow. And I mean, it's a cycle.
Yeah. Add in the pacifier, all the pouches.
Yeah. Pouches, applesauce pouches. Nobody wants their kid to chew anything.
The cheeks pushing the teeth this way. You've got the tongue pulling. Anyway, it's all
related. And so it sounds silly, actually. I'm like, you're a really educated person. I'm really shocked he was even speaking that way. It just was very ad hominem and very angry. And I'm like, somebody needs a hug. He was just very upset. And I thought, man, somebody had a bad day and wrote an opinion article. But at the end of the day, if you don't want to be a wellness, comprehensive dentist, a comprehensive orthodontist, and you just want to be a tooth mechanic and move teeth around and make them look pretty, or just drill and fill, that's okay. We need those too.
Exactly.
We need those too. But please don't ignore the symptoms in your chair and just refer to someone that does want to do it. So if that's all we're saying. But talk about like, what are the age groups that you're treating in your practice? Like, where is ASAP kind of launched you? Because we both have a similar mentor, Dr. Kevin Boyd in Chicago.
Yeah. I was going to say, Dr. Boyd really got me onto the track of primary teeth. I can't thank him enough. He was kind enough to let me shadow him for a summer. I was at his office almost every week while I was pregnant with my second. And that's how I really just started seeing him read Combi CAT scans. I would videotape him and watch it later because, man, does he know a lot. Yeah. And he say so many things I couldn't catch it fast enough. So I would sit him down and say, okay, can I videotape you? And so I saw him doing the BioBlock and just working with parents and educating parents. And, his team knows what they're doing. Man, does he have some assistants that really know this stuff themselves. And I learned a lot, and he really helped me understand what expansion is, what our goals are, how to talk about it. We're making room for the tongue. We're not necessarily treating airway. That's maybe one of our end goals and results that we get, but we're making room for the tongue.
I think that's important right there. Let's talk about that for a second, because what also in that article, it was about, pretty much criticizing the population of orthodontists and pediatric dentists and family dentists that are saying they're helping the airway by doing all these things. And here's the reality of it. We're seeing malocclusions, okay? Baby teeth without any spacing, or even worse, crowding, has been, even in the literature 100 years ago, in the orthodontic literature, considered a malocclusion. Okay. So we all can agree that is a malocclusion. No spacing in baby teeth. I mean, you should be able to put like a penny between every baby tooth. And if you don't have that, that means the bone's deficient. Okay. So we are dentists. We are orthodontists. We are pediatric dentists that are looking at a malocclusion in a child, which is what? It's a hiccup in the growth and development. They have a bone deficiency. And we're intercepting, okay? We're making room for a tongue that doesn't really have room. And then we're asking the question, why? Which is what the paper from 1918, an orthodontic paper that Dr. Bogue discusses. You must ask the question, why? Why the bone deficit in this 3, 4, 5-year-old child? Because it's not going to get better on its own. Okay. So then the question becomes, well, why not wait till later and just address it later? Because the orthodontists will do expansion later. They will. Right. The argument is they're like, why are you doing it now? Why are you doing it earlier? Well, why not? When you see a malocclusion in a 3, 4, 5-year-old, and they don't have proper room for their tongue, obviously the tongue isn't living up there where they wouldn't have all that deficit.
Right.
And then we are then asking the question as a healthcare provider, why is it like this in the first place? So now we're looking at a child that is in a demographic that no one's even seeing in orthodontics, really.
Mm-hmm.
And we're saying, let's look at this child's function and their breathing and their sleep. And then we refer appropriately, maybe to an allergist, to an ENT. But we're also addressing the malocclusion. We are creating room for that tongue because we want to get them caught up to where they should be for their age, proper spacing, proper room for their tongue. So we're doing dentistry, okay, with a side effect of, wow, now they have room for their tongue. It's more up and forward. Now they can breathe better because we have now collaboratively worked. We've identified a malocclusion and we're collaborating with that ENT, Julie. It's like, what is the harm in helping a child early when you see a child that cannot see well at 2, 3, 4, 5? We give them glasses.
Yeah. I mean, and it's interesting, a lot of the things we're talking about can be symptoms of all this. Like you're sending to an allergist, but why do they have allergies?
Yes.
We don't know those answers all the
Yes.
time. But I have seen cases where I help establish nasal breathing by referring to a myofunctional therapist, and allergies get better.
Yes.
Maybe they're fixed, but they get better. Asthma, same thing. I mean, this is all really,
It's
really,
multifactorial. And
I think that's one of the hardest things for parents is they come to me because somebody told them, oh, you need to see your kid has behavior issues. You need to see Dr. Julie. And then they come see me and I say, okay, you need an ENT, you need a myofunctional therapist. We need to consider body work. And they're like, what's
wait a minute.
or like, yeah, why can't you just do it? And it's like my expansion, my jaw growth development, it's not going to be maintained if you don't see a myofunctional therapist. Don't invest in your child to get room for the tongue if you're not going to maintain it.
Yes, absolutely. Because you're not addressing the reason it's like that in the first place.
Exactly. And that's hard to understand as a parent because we are so busy as parents. I'm going through it right now with my baby. I mean, he had a release at 5 days. Then we saw myofunctional therapy for every week for 2 weeks on top of my postpartum appointments and my, PT appointments. And then my kids got sick and I had to take them. So I understand I'm going through it and it's not for everybody. And that's okay. Like if I explain to a parent, you're going to have to do this, this, and this to make this worth it, they have to go with their mom gut or their parent gut and decide, like, can we do this as a family?
And that's a good point too. You said earlier before we started recording, you're like, look, I tell parents, you might get a second opinion and go to maybe a more traditional practitioner that doesn't understand maybe sleep, airway, breathing, and you might get a totally different treatment plan. And that's okay. But you as the parent, what are the goals? And what are we trying to accomplish? And what lenses am I looking through? And what lenses are the other healthcare provider looking through? And that's where the parent has to make a decision as to what they want to accomplish. And they have every right. Please do go get that second opinion. I love for you to go get a second opinion because then you feel better about your decision.
Yes. I piggyback that and agree 100% because I don't ever want to. This is different than the traditional orthodontists are doing, and I'm not trying to take work from them. My forte right now is a child with all baby teeth. I am not moving those teeth to get them straight. I'm moving those teeth to develop their jaws and make room for their tongue. And like, if we go back to where we started, Dr. Boyd really helped me recognize that. And then his associate, Dr. Janet, is, brilliant. And she really encouraged me, like, you need to get started. There's a lot of kids who need help and you can do it. You can do it.
And let's talk about this for a second too, because, again, we're seeing a demographic. I want to piggyback what you said. It's not like we're trying to take over orthodontics. If anything, I would say the majority of the airway-minded, comprehensive dentists doing this and orthodontists doing this, the demographic we're seeing is not even a demographic being treated right now. We're addressing a population that is totally off the radar, okay? And we're setting them up. And you know what? If they need orthodontics later, I refer to my orthodontist.
Yeah, I don't want
After
to.
I don't want to deal with the mixed
Yeah,
dentition.
no.
You have them at
Yeah,
that point. And these parents are set up, teed up, and ready to go for orthodontics.
yeah,
And if they need additional expansion, some of
right.
them need two rounds of expansion for different reasons to maybe get the canines. Yeah.
And I would say I actually always tell my parents of these little people, I say, I am not doing this to develop straight teeth later. You are going to most likely need braces when your child is 10, 11, 12, or maybe sooner. I don't know. What I'm doing is helping right now because we need to maximize on the growth. But this does not change the fact that your child might need braces. I can't
Absolutely.
help with that right now, but what I can help with are the symptoms you're talking to me about right now. And it oftentimes makes braces way more straightforward later.
Yes, very
And
much so.
probably develops a more beautiful smile later too. Like if you let a child develop, misaligned jaws until they're 12, the results of that ortho might not be as beautiful as the results of, a child that you or I might treat to guide the jaws to be more aligned, and then all you have to do is, widen the smile. So I think it sets up for a really successful case for an orthodontist, actually.
Yeah, I think it's a beautiful layup for an orthodontist down the road. I think, and more importantly too, it's like the reason why we're doing this is it's the right now because kids can't wait. Because when you see a malocclusion, you should address it. When you see a child not developing properly, you should address it. Which doesn't mean, well, let me just keep watching you every 6 months, and not address the why behind it. Um,
These kids
so
in school because they're sick all the time. These kids are having to change schools because of behavior issues. I mean, they can't wait. They need better sleep to function and grow in other aspects of life.
100%. What are, and again, too, some of the loudest voices opposing, they'll say, you don't have literature on this. There's no literature on this. Everything's anecdotal. Well, first of all, the literature is emerging. Okay. But you have to start somewhere with patterns in your practices when you have thousands and thousands and thousands of doctors saying, this is interesting. When I did this child started breathing better. When I did this at this age, this child started sleeping, breathing better, behavior started improving. And that's what evidence-based medicine is you see patterns within your practice. And that's why it's called the practice of dentistry, right? The practice of medicine is we're all trying to do the best for our patients. And when you see these repeating patterns, it's like, okay, now we need to maybe investigate the why behind it. And that's where literature starts emerging. But what are you seeing in your practice? Why do you like to see these primary teeth malocclusions and address it now? Why don't you want to just wait? What do you see that makes you say, oh my gosh, that was so worth it?
I think it started with my kids actually because I want the best for them. And if they're like, I mean, it all comes down to, in my opinion, getting enough oxygen to the brain while we sleep. And don't, if your kids are not getting that restful sleep, they're not going to wake up refreshed. They're not going to do the best they can that day. They're not going to become the CEO, or like if you really go that far out, right? And so I have seen some amazing just transformations, moms coming in like my child, like, and I don't even, sometimes it's not even me. It's just that I told them they needed an ENT.
100%.
Pediatrician
Yes.
didn't for whatever reason, because the pediatricians have so much on their plate.
Yes.
They need to make sure the vaccinations are done. They need to make sure that they're breathing, well, sitting upright. I mean, there's so much on their plate. So I have a child who, had malocclusion, so his lower jaw was in front of his, like if you weren't a dentist, class 3 for the dentists out there, but the lower jaw was ahead of the upper jaw, so they had an underbite. And I said, I think I looked back there, tonsils are huge. I'm like, you need to see an ENT. Mom called and said, thank you so much. The ENT couldn't believe the dentist was the person to send me to them. And I was so proud of myself. It's like, thanks for telling me because we are just trying to help. And then she called again and said, wow, we're post tonsils and adenoids removal 2 to 3 months, and I have a different child. I can manage him. He goes to school. He's happy in the morning. I'm like, yes, that's what we're doing this for.
And then we see it, and it's 100%. And we see the changes from, and again, when you're a primary care dentist, when you are a pediatric dentist and you're seeing these little bitties, I mean, some of these kiddos, like I knew them before their moms were even pregnant with them. And then I'm walking the mother through pregnancy, right? Making sure she's getting restful sleep and breathing well. And sometimes mamas develop airway issues during pregnancy, gestational apnea, basically, or flow limitations. And so I'm trying to help the mom through pregnancy. I'm like helping this baby while it's growing because the mom needs oxygen. Then I'm seeing this child in its little pumpkin seat, right? When mom comes in for her checkups. So we are watching these babies grow, and then we see the hiccup. Okay. We see the hiccup in the growth and development. So now you've got this child with this class 3 or the lower jaw or lower jaw in front of the upper jaw for those that don't know what a class 3 is. And it's like, we've got to intercept that. We've got to help. And a lot of times, we've just looked at, even Tracy's got a good lit review on, when you have enlarged adenoids, a lot of times you see a class 2 development where that mouth breathing, lower jaw, it's developing in the wrong direction. And with class 3s, you see sometimes really big tonsils pushing that the tongue is going for. Again, the tongue, the muscles, that airway is driving the growth and development. But then when you have the hiccup in the growth and development, even when you address the airway, so it's super helpful to address tonsils and adenoids and allergies. But when you have the growth and development side effects that have happened from the poor breathing, you've got to address those too to optimize the airway again. So it's the chicken or the egg. It's like you've got to work with both. They're both important. It's not either or. It's like it's a person. You've got to address all of it, which, like you said, can be, sometimes a lot. A parent walks in and they think, hey, dentist, make my kid magically better with your magical Invisalign first or your magical expander. And it's like, it's not magic.
It'd be just me. Like this might be where we start, but it might not be where we start. As the dentist, we kind of act like the quarterback. Like, okay, I can't even get in your child's mouth because they are so fearful. They gag so much from giant tonsils. I can't even start expansion until you see an ENT, because I can't get in there. Or the tongue is so tight. Like we need to start there. There's so many issues with picky eating, or like I might not be the starting point, but I know enough of, and I know a lot of great providers now, which took a long time. I mean, Dr. Boyd was really helpful to introduce me to a lot of people, but it takes time to get to know people and to understand what they do and what they do best. And then I started with ASAP Pathway, who I actually shadowed Dr. Maggie Graham in Milwaukee, and she showed me the platform and really encouraged me to join. And ASAP is really the reason I jumped in and started doing Invisalign on these little kids, and Invisalign first. And it's amazing. The parents are always like, oh, they're never gonna wear it. They're not gonna.
I get it all the time too. Oh, my kid will never wear that.
I kid you not, under 6. I mean, my approach is I sit them up in the chair. I'm like, look at this cool retainer, this cool mouth jewelry you're going to get today. Like, can you put it on for me? I don't even put it on for them. I help guide them. I hand it to them the right way and I show them how to they put it on themselves and the parents are like jaws on the floor. I'm like, it happens time and time again. And the only child who hasn't put it in for me, he needed an ENT first.
Yeah. You're like, okay, here we are back to square one.
He couldn't manage anything more in his mouth because his tonsils were so big. He needed all the space that he could get to breathe. So he needed the tonsils removed first, and then it's going to be a whole different situation once we get that, I think. I
I
mean,
think
yeah.
I think that's so funny. We just had a conversation yesterday. I had a little boy, he's 4 and he has an open bite, really narrow arches. He's going to need myofunctional therapy as well, but I'm going to make room for the tongue. And then once I make room for the tongue, now we have a place for the tongue to go to relearn how to swallow. Exactly. He's had adenoids removed twice. So they grew back. He's still mouth breathing. So told mom, I know you don't want to hear this, but we're going to get another opinion from an ENT. I think we might have some allergies at play here, some chronic rhinitis. Something's going on because usually people are mouth breathing because they're obligated to, because they can't breathe through their nose. So something else is going on. But my assistant's like, oh my gosh, one of my newer ones, she's like, this isn't going to work. He's never going to do this. I can't scan him. Scanned him beautifully.
Yep.
Attachments on his teeth. Oh, yeah. It's never going to work. He's not going to let us put attachments on. I mean, these kids sometimes are easier by far than like some of my 12-year-olds that I'm putting in regular Invisalign, and they're whining because, this and that. I'll take a 4-year-old any day. So it's exciting to watch. And we do like a PSQ every time we see them. Do you do that too, Julie?
Yeah, I actually, in my practice, so my practice is mostly restorative dentistry, like fillings, crowns, veneers. I do a lot of cosmetic bonding, all those sorts of things. So my hygienist, any child 12 and under, we do a PSQ at every checkup and cleaning. And then also my kids I'm actually treating, they do one every time they come in.
And let me tell everybody what a PSQ is. It's a pediatric sleep questionnaire. It was developed by Shervin. It's the only validated sleep questionnaire that really draws a very basically a conclusion of poor sleep health. So go ahead. So you guys are doing the PSQ on them when they come back for checkups,
and it helps open the eyes to parents who maybe aren't thinking about these things, like, oh, why are you asking me these questions? And so sometimes I'm helpful in that way, just getting some information out there. And then, to be honest, there are also some families like, I don't want to do those anymore. And that's okay,
Yeah.
We have to help in whatever way we can. And so those are the families that I'm just keeping the teeth clean and treating the cavities, and that's okay too. But I know I can help more when people are open to it.
And that's a very important point, because you want to be on the same level with anyone you're caring for. They have to appreciate and have the same goal you have, because we're a team, right? The parent is a team player, the doctor's a team player, the patient's a team player. And if we're not all on the same team, like, let's not do, I'm not going to push the care that I think you should have. If you don't feel you need it, I can't care about that being done more than the parent does. And it's okay. It's okay. They're just not there.
Yeah.
So go ahead. I'm sorry, it cut out.
I think that it took, when you asked me to do the podcast, I started thinking about, what would people want to hear about? And I think the dentists out there listening, it's hard to get started. It's different, but I will say it's been so meaningful, and ASAP has really helped me gain a lot of confidence. I mean, I keep thinking about the Dr.
David McIntosh.
His last addition to the platform. I mean, I learned so much. It's an amazing way to just continue your learning in bite-sized pieces. It's great.
Well, I appreciate you saying that. I mean, what we strive to do, okay, because Tracy, Michelle, and I, who've all co-founded together, Michelle and I are parents of kids that struggle, just like you, Julia, with kiddos, and we wanted help. And then Tracy was wanting to help kiddos and we've got a podcast about why we did it so people can understand, like, where the heck are we coming from? What is this platform? What we wanted was comprehensive. Okay. Comprehensive. We have tons of literature.
Mhm.
Of course, we have anecdotal. We're all doctors. We have experiences within our practices, and we, by far, yes, we discuss that in our platforms of what we're finding. But it's about understanding sleep medicine. It's about understanding how to collaborate with our medical colleagues and where to start. And the plastic isn't magic. Okay. It's about understanding your diagnosis. And when that child sits in your chair, where do we start for that kid? Because
Mhm.
each kid's different.
Right.
And every practitioner is different, right? We were talking about this, Julie. Not every ASAP pathway provider does skeletal expansion on a non-grower or does mixed dentition expansion, and some of them don't want to work on the little bitties. They feel more comfortable with the older population of kids, and that's okay. That is
Mhm.
okay. But we're all here collaborating, working together. What is one of the with some of your early interceptive? What's a story you could share that makes you want to keep doing this, like on these little kids with primary teeth, and what's happened that you have experienced as a practitioner on one of your patients you're caring for that makes it worth it?
Um, I think the one that's most recent sticks out the most, which is the one that I shared, just having an ENT be really impressed that I could recognize tonsils and adenoids as a dentist were holding this child back. But I also have it's like the little things. When you ask me that, I'm not thinking of one patient. It's like
Yeah, you're right. You're right. Good point.
I have a 7-year-old who I'm expanding, and it took a while. It was like maybe 6 months into treatment, and then the mom finally came in and said, "Wow, she got sick and she blew her nose and snot actually came out." She's like, "I couldn't believe it." And now that sounds funny, maybe to somebody listening, but if this child is 7 and she's blown her nose and nothing ever came out, and I was able to open the roof of the mouth, which is the floor of the nose, and now this child can get better quicker. Like
That's a
mom,
win.
mom said she was only sick for a few days, and when she gets sick, she's down for a month. I'm like, that to me is really cool because kids can't wait. And just that minor change is going to affect her being able to go to school every day and her being able to learn and focus. And so that was one I thought was really interesting that I didn't expect. Um, Another one was like about 2 months into treatment on a 6-year-old mom comes in and she's like, she doesn't snore anymore. It only took 2 months. She doesn't snore anymore. She's sleeping better. Our family's happier. I'm like, that is really cool.
That is very cool. And snoring is it's a pretty objective, you either are or you aren't. And that's not something a child can control. So it's not like it's like they're making this up. I mean, they're either snoring or you don't. There's either an obstruction and you're making that funny choking sound or you're not.
Right.
I just I the reason I mean, so many reasons I love to have you on, but we always joke. You have like a nickname in ASAP. We call you ClinCheck Julie, because every week, so we had like weekly ClinCheck reviews for the providers, and everybody's putting up their ClinChecks, and we're discussing with Dr. Levine, like how you can best optimize and in different ways that you can modify the physics of the ClinCheck, et cetera. And Julie, you are always on there. It's like, oh, it's ClinCheck Julie.
I mean, hey, I can't express how helpful that part of ASAP was for me. I mean, just getting the confidence to know like other people are doing, because there's not really anyone in my area doing this. And it every week was like, yes, what you're doing is helpful. Like you want to have a community of people who can um, support you what you're doing and believe in it as much as you do, because like the article we've been bringing up over and over, there are people in my community who maybe don't think what I'm doing is as important as I do. So it's helpful. Like, I'm human. We're all human. We want
Yes.
to know that there are other people who like that what we're doing is right. And I mean, we see it in the symptoms, but it's also so nice to have the community. And those reviews with Dr. Levine and Dr. Tracy were just transformational for me.
For me too. I learned so much. I mean, I'm like, it is a rabbit hole, man. Once you get involved in this, it is
A
like,
fun
I
one.
learned so much. I
Yeah, it's
learned,
so great.
oh, I can't. Well, I'm so appreciative that you came on today and just keep doing what you're doing. We just appreciate you. You're a leader in your community. Your patients are so blessed to have you, Julie. And just keep doing what you're doing. And I know, but you need some rest. You're a busy mom. You got to take some time for yourself.
Mean, I could say the same about you because I was floored that I would be asked to be on the podcast. So thanks for having me. I
Oh
mean,
my gosh.
I learned from just this talk. I mean, that's one thing I notice about ASAP and just people interested in this. Like, we're in it to help people, not for any other reason. And so anytime you talk to somebody with this passion, you learn something because every child is different.
It's
I
so
have
true. No cookie cutters.
Yeah, like I haven't seen the kids you've seen and you haven't me, and I learn something from all those little people every time I help them. I mean, it's like, okay, I can help the next person even better. It's one of the reasons I love it. So,
Yeah, that's a really good point too, because it is, you take little pieces, like you said earlier. It's not like it's one particular thing. It's like, okay, this happened with one kid, and then this happened with another kid. And then when you see that pattern again in another child, it's like, this might be a symptom we see some resolution to. But at the end of the day, Julie, I love being a dentist. I love, like what we said earlier, I love dentistry. I even love general dentistry still. And um, I think we have such a unique, and I think really over the next few years, you're just going to see medicine really leaning on oral medicine more, because we are hopefully going to start seeing patients more comprehensively, and not, the mouth is separate from the rest of the body, which we know it's not.
mhm.
It's connected, very important connections. And I think the role of dentistry with medicine, I think we're going to see more communication and collaboration. And I hope these conversations get more dentists open to wanting to collaborate, because that's another thing we're not taught in dental school, is how to collaborate with our medical colleagues, and how to communicate properly with them, to keep continuity of care going, and sending them letters, and having those occasional Zoom conferences with them to get them caught up on a patient, or let them know what we're doing in our practices. So, like you said, it's taken you a while to build your team, right? It takes perseverance. And so it's not for the weak-hearted. You've got to really want to do this and help make a difference in your community. And not every medical colleague is going to want to collaborate. So you got to find the ones that are vibing with you.
Mhm. Yeah.
So kudos to you for doing that in your community, because it's not easy. And your perseverance is helping so many kids, so many families. So thank you so much. I'm going to put how people can find you in the links, but her handle on Instagram is at Julie Davis DDS, and it's Julie DDS on TikTok too, right?
This DDS. Yeah. TikTok is where really I started educating the most. And it's amazing how many people reached out to me with questions and looking for answers. And it's cool. I mean, it's different, but it's been a journey.
Well, it's impressive. I went to it and I started following you. I'm like, my gosh, she's amazing. I feel so guilty. I need to
Don't watch my
up my
dance.
game.
Don't do it.
I just love how you're just so real. You're a mom. You're just talking to people like a real person. I think that's what resonates, is your authenticity with people. So I'll put your links and how to find you if people are looking for care. Dentistinparkridge.com is your website too. So if people are looking for an ASAP pathway provider in that area, they can find you there. I'll put it in the links. And I always like to end with a couple of questions like about people's childhood. I love it. So I was going to ask you a few questions if you have a second. What was the first pet you remember having as a kid?
We got a dog when I was probably 5, and she was my buddy. So
Oh, what was her name?
Jessie.
Jessie?
Yeah.
What
I
kind
mean,
of dog was she?
we called her Jessie. She was a flat-coated retriever. So it's like a big black golden retriever. She was all black, but she has the long
Wow.
retriever. And yeah, they're really cool. They're really cool, but headstrong. She was tough. Not for me, on me, but on my parents.
Oh, that's so sweet. I think our pets that matter so much. When we're little, they are our buddy. I mean, they're our family now. Good grief. I mean, my dogs now are my fur babies. I love them. What was your favorite when you were little? Like, what was like your favorite meal that your parents would make that you're like, oh man, this is my favorite?
Oh my gosh, I eat so many things, but I it's funny enough. I love lobster, and my parents, we made lobster on New Year's Eve like every year since I can remember. We had it this year, and so maybe because it was special too, like
Yeah, it's special. I was gonna say that's pretty darn special. I did
like
not
an
have.
easy one would be like mac and cheese. And if I'm sorry, my mom, we made mac and cheese a lot because I really liked it, but we just called it cheese noodles. I got to college and was like, "Oh, we're having cheese noodles," and my friends were like, "What? Mac and cheese?" I'm like, "Oh, like just those funny things within your family." Like,
Yes, family dynamics and what nicknames for things that I mean, there are things we were just talking in our family the other day about. Like, I grew up thinking was one thing, and then you find out later your whole life you had no idea that you were saying it wrong
oh
or
yeah.
that your family
Oh.
was so jacked up for how they said it. Like, what is wrong with us?
I mean, I thought everybody only painted their nails in the bathroom. And I got to college and my friends are painting their nails in the living room. And I'm like, what? And I called my mom and she's like, well, I didn't want you to spill the nail. Like just silly things, they're like tiny, but
It matters. And then what was the favorite game like you remember playing as a kid? Like one of your favorite games?
um, hmm, that's a good question. What did we play a lot? I think that Guess Who game.
Guess who? What was that one?
You had like it like fit you were playing with one other person and you had a bunch of people like flipped up that face you. And then
Yes.
you're like you have one that's your person and you're flipping, oh, my person has glasses, and then you flip all the people down who don't have glasses and you try to come figure out who they have facing them.
It's like Clue, but like for like guessing who people
I
are.
love that game.
That is so cool. I love it. Well, thanks so much for being on. What were you gonna say?
You changed it up on me, by the way. I've listened to, there's some great value in a lot of your podcasts. I've learned a lot, but you always ask the cereal, the super. I was ready to go.
Well, what is your favorite cereal? Tell me
Lucky,
what you had prepared.
Lucky Charms, my superhero. I'm not really into superheroes, but I was gonna say Barbie because she's
Ah,
cool. Because I saw the Barbie movie and I loved Barbies.
it's so cute.
I was ready for you.
You know what's funny is I do try to mix them up, and then sometimes I'm like, man, everybody likes the cereal question. It's like, and then I mixed it up on you. So, but at least
So
I know
funny.
it's Lucky Charms. We'll have to have some Lucky Charms together someday.
Absolutely.
Maybe at our next course, we'll split a bowl of Lucky Charms. Well, thanks, Julie, for coming and keep doing what you're doing. We just appreciate you so much, and you're just a rock star.
Thank you. Thanks for having me on.
All right, we'll see you later. See you, friend.